Welcome to Dr. Barun Urocare. Today we'll be talking about DJ Stent or double J stent. You have been often told about any stone surgery, any kidney, ureter or bladder surgery that a double J stent has been fitted in your body and you have to remove it after a certain period of time. It may be 2 weeks, 1 month or even 2 months depending on whatever your condition was. Today we will be talking about its specific symptoms and why you should not be afraid of these. So a double J stent is a very narrow polyurethane tube which connects your kidney to the bladder. Its main use is to make the ureter patent and ensure unobstructed urine flow from kidney to the bladder. When a double J stent is in your body, you can experience these symptoms. Number 1, a little discomfort while you pass urine, especially when you feel the urine is going upwards towards the same side. Why it happens? Because the double J stent makes sure the ureter is patent, but it also makes sure there is a retrograde flow whenever your bladder contracts. There's nothing to be afraid of. In most cases, patient don't feel it. Sometimes when patient feels it's only mild discomfort. We anyways give drugs to counteract these symptoms. Number 2 is you can often see a little bit of blood in your urine when you pass it, especially when you have done a heavy weightlifting or exercise or walking. Why it happens? Because your stent moves in your body and it touches something inside, and sometimes it causes little bleeding. There's nothing to be scared of. It goes away when you drink plenty of water. Number 3 is a little heaviness on the side in which you are sleeping. So it can happen with a double J stent in situ. You should not be worried about it. It often goes with a little analgesics, and most of our patients are comfortable with double J stent in situ. Number 4 is you can have a frequency of urination. Why it happens? Because one coil of the stent is inside the bladder, which sometimes irritate your bladder and makes you to pass urine again and again. This is again also happen in only very small number of patients, and often it is corrected by some medicines which you prescribe along with stent. So these are the symptoms which you should not be afraid of when you have a double J stent in situ. But there is an important message after that. Double J stent is an important part of any urological procedures we do, and ensures a faster recovery, a quicker recovery, and a complication-free post-operative period. However, it is important for the double J stent to be removed in a defined period of time. Most of the stents have to be taken out within 3 months, which are the routine stent we use, polyurethane material. Sometimes we use black silicone material when we want to keep the stent for a longer period of time, say for 1 year. In that case also it should be taken out within 1 year of time. When it is not taken out in the definitive period which is scheduled for the DJ stent to be removed, what can happen? So these stents can be encrusted, in which case the stone is formed within the stent, and in later part their removal may require major surgery. Moreover, these stents when left inside the body for a longer period of time makes biofilm, and these are infected, which can cause fever, dysuria and hematuria again. These stents can also be broken, and then they pass through the urine while you pass urine, and we have seen so many complications of stent when they have been forgotten and left inside your body. So DJ stent, however, it is a very important part of our all urological procedures which we do most of these days, and it has made everyone's life easier. But we have to understand the nicks and knacks of how and which symptoms are important, which symptoms you should see your doctor, which symptoms you should not be afraid of. Thank you.